Ladies and gentlemen, healthcare today is drowning in data. From electronic health records and lab results to real world evidence and payer analytics, there's no shortage of numbers. But here's the problem: more data doesn't always mean better decisions. In fact, sometimes it does the opposite. We've all seen it happen. Dashboards with dozens of KPIs, reports that run hundreds of pages, endless meetings reviewing data but leaving with no clear action. The result? Decision fatigue, missed opportunities, and wasted time. That's why data storytelling has become one of the most critical skills in modern healthcare. It's not just about presenting numbers, it's about turning those numbers into clarity, meaning, and action. In this tutorial, we're going to explore exactly how to do that. You'll learn why data overload is one of the silent killers of effective decision making, how to transform raw numbers into narratives that resonate with your audience. The key elements of a powerful data story: hook, conflict, rising action, climax, and resolution. How to deliver your message with confidence and authenticity. And most importantly, how to use storytelling to drive change, inspire action, and improve outcomes. This isn't just theory, this is about giving you practical tools you can use in your next meeting, your next report, and your next big strategic decision. Because at the end of the day, data by itself doesn't drive change, people do. And people are moved by stories. So, let's dive in and learn how to make your data tell a story that matters. Let's start by calling out the problem. We are drowning in data. In modern healthcare, data is everywhere. Electronic health records, patient satisfaction surveys, claims data, real-world evidence, wearable devices, even social media signals. For healthcare leaders, medical affairs teams, and decision makers, this feels like sitting in the middle of a flood with no life raft. The issue isn't that we don't have enough information. It's that we have too much and too little clarity. Instead of helping us make faster, better decisions, data often overwhelms us. You've probably seen it: dashboards with hundreds of metrics, reports that are 80 pages long, spreadsheets with endless rows and columns. The result? We lose sight of what actually matters. This is where things get dangerous. Important insights get buried under noise. Signals that could have alerted us to an emerging safety issue, a change in patient behavior, or a shift in market dynamics can go unnoticed until it's too late. And this overload has a human cost. Leaders waste time filtering through irrelevant data. Teams experience analysis paralysis, and decisions are delayed or made on gut feeling rather than evidence. The crisis we face isn't a lack of data. It's a lack of clarity and prioritization. And unless we address it, we risk turning data, one of healthcare's greatest assets, into its silent killer. Now let's talk about what this complexity actually costs us. Every time a decision maker spends hours deciphering a complicated report, that's time not spent acting on the insight. Every time an important signal is missed because it was buried in an avalanche of numbers, we lose opportunities to improve patient care, optimize resources, or prevent risk. Missed opportunities are everywhere. A hospital might miss a chance to intervene early on rising infection rates. A pharma team might fail to detect a new off-label use pattern that could inform safety strategy. Payers might miss cost trends that could have been managed proactively. Complex, poorly communicated data also leads to ineffective decisions. When leaders can't clearly see which metric matters most, they may make choices based on partial information or focus on the wrong priorities altogether. The ripple effects are real: wasted budgets, delayed treatments, poor resource allocation, and, in the worst cases, harm to patients. Complexity also affects morale. Teams feel frustrated when their work isn't acted on because the insights got lost in translation. The bottom line? Complexity has a cost, and in healthcare, that cost is measured not just in dollars, but in patient outcomes. The more confusing the data, the greater the risk that decisions will be delayed, suboptimal, or simply wrong. And here's the heart of the issue. Traditional reports aren't cutting it anymore. Most reports do a great job of presenting facts, numbers, percentages, tables, charts, but they rarely tell a story. They rarely answer the most important question. Every decision maker is silently asking, so what? A report might show that patient satisfaction dropped 5% last quarter, but without context, that number doesn't inspire change. It just sits there. What caused the drop? Which department is most affected? What action should we take? Traditional reporting tends to be descriptive, not prescriptive. It shows what happened but doesn't guide what to do next. And worse, it often overwhelms the reader with so many data points that the key message gets lost. This is why data storytelling is so important. Storytelling turns data into a narrative that has a beginning, middle, and end. It sets the context, highlights what matters most, and shows the impact of taking action or doing nothing. When we fail to tell the story behind the data, we fail to motivate change. Reports become static documents instead of catalysts for better decisions. And in healthcare, that means missed opportunities to improve care, reduce risk, and deliver value. Traditional reports aren't bad, they're just incomplete. To drive real impact, we need to move from dumping data to delivering insightful, actionable stories that answer the so what and compel leaders to act. We can now start with what we actually mean by data storytelling. Data storytelling isn't just about making prettier charts or adding colorful infographics to your reports. It's about taking data and turning it into a clear, compelling narrative that inspires action. A good data story has three parts: context, insight, and action. It gives your audience the why before the what, setting the stage with a problem or opportunity they care about. Then it shares the most important insight from the data, not just every possible metric. And finally, it answers the question, what do we do next? Data storytelling is human-centric. It's not about overwhelming your audience with sophistication. It's about connecting with them. Think about how much easier it is to remember a patient case study than a table of statistics. People remember stories, not spreadsheets. And this matters more than ever because in healthcare, our audiences, whether they are physicians, payers, regulators, or internal executives, are busy and overloaded. They don't need more data points. They need clarity, relevance, and meaning. So, when we say data storytelling, we are really talking about taking the science, the evidence, the analytics, and translating them into a message that resonates, motivates, and moves people toward action. But why does storytelling work so well? The answer is in the brain. When we show someone a spreadsheet, we are mostly activating their language and analytical centers. They may understand the numbers, but that understanding is often shallow and short-lived. But when we tell a story, we activate multiple brain regions at once. Sensory areas light up. When we describe what a patient felt, emotional centers engage when we talk about impact. And the mirror neurons in our brain help us empathize with the people in the story. This combination creates connection and retention. Research shows that people are up to 22 times more likely to remember information when it is delivered as part of a story compared to facts alone. That's a staggering difference. In healthcare, this is incredibly powerful. If you want a physician to adopt a new treatment protocol, it's not enough to show them efficacy rates. You need to show them how that data translates into better outcomes for their patients. And let's be honest, stories cut through the noise. When everything is urgent and data is everywhere, a well-crafted narrative grabs attention and holds it long enough to inspire a decision. Storytelling isn't just a nice to have communication skill. It's a science backed method for making sure your message sticks and actually drives change. Let's bring this to life with a few quick examples. One major hospital system used data storytelling to tackle high readmission rates for heart failure patients. Instead of sending executives a 20-page report filled with metrics, the quality improvement team told the story of one patient, John, whose readmission could have been prevented if certain steps had been taken. They overlaid John's story with the data, showing how he represented hundreds of patients. The result? The leadership team immediately approved funding for a new discharge education program, and readmissions dropped by 15% in 1 year. Another example comes from the pharmaceutical industry. A medical affairs team wanted to highlight the need for additional real-world evidence on a therapy. Instead of presenting raw claims data, they built a narrative around the patient journey, showing where the current evidence fell short. This helped secure internal support and budget for a new observational study that later became key to the product's value proposition. Even public health campaigns rely on storytelling. During the pandemic, data alone wasn't enough to change behavior. It was when governments and health systems shared personal stories of lives saved, of healthcare workers on the front lines, that vaccination rates increased. These examples show the power of combining data plus human story. When numbers are put in context, they stop being abstract. They become real, urgent, and actionable. Now let's move to the third part of this tutorial about crafting your healthcare data story, which has 3 sections. Section 1 is about identifying your audience and their why. And here we have to know that every great data story starts with one crucial question: who am I talking to, and why should they care? This step is often skipped, and it's why so many reports fall flat. The same data can mean very different things to different stakeholders. If you're presenting to a hospital board, they may care about strategic outcomes, cost savings, quality scores, and compliance metrics. Clinicians might care about patient outcomes, workflow efficiency, and clinical evidence. Patients care about what impacts their lives directly: access, safety, speed of care. When you don't tailor your story, you risk losing your audience's attention, or worse, failing to inspire action. So before you even start building charts or slides, ask, what is their why? What keeps this audience up at night? What decisions are they responsible for? What would motivate them to take action? For example, if you're presenting data on reduced readmissions, the board might want to know how this improves reimbursement rates and hospital reputation, while clinicians will want to see which interventions worked and how they fit into current workflows. Knowing your audience's why helps you decide what data to include, how much detail to share, and what tone to use. This is the foundation of effective data storytelling. It's not about telling people everything you know, it's about telling them what they need to know to make the right decision. Section 2 is about the key elements of a data story. Because once you know your audience, it's time to craft the narrative. A strong data story has structure, just like any good story. Start with a hook. This grabs attention. It might be a surprising statistic, a striking patient case, or a provocative question. The goal is to make your audience lean in and think, I need to hear this. Next comes the conflict or challenge. This is where you lay out the problem or opportunity. Think of it as the tension in the story, the pain point that needs to be solved. Then we build the rising action. This is where your data points come in. Each metric, chart, or observation should add to the understanding of the problem. Avoid dumping data. Instead, layer it like clues in a mystery. building toward the solution. The climax is the key insight, the aha moment. It's where you reveal what the data is really telling you and why it matters. Finally, end with the resolution, your recommendation or call to action. Show your audience what success looks like if they act on your insight, and what it might cost if they don't. This structure transforms a presentation from a data dump into a compelling narrative. And when done well, it keeps your audience engaged from start to finish. And finally, section 3, about visualizing for impact. Because even the best narrative can fall flat if the visuals don't support it. In healthcare, we often rely on basic bar charts and tables, but that's not enough anymore. The goal of visualization is not just to display data, but to make insights impossible to ignore. Start by decluttering. Simplify charts so the key message stands out. Use color strategically. For example, highlight the one metric that matters in a bold color while graying out the rest. Then, go beyond static charts. Infographics can condense complex information into a single, memorable visual. Interactive dashboards allow stakeholders to explore data at their own pace, drilling down into the areas that matter most to them. And narrative visuals, like patient journey maps, bring a human face to the numbers, showing how data translates to real-world experiences. The most impactful visuals guide your audience through the story. They don't overwhelm. They focus, clarify, and amplify your key point. Remember, when you present data, you are competing with distraction and fatigue. The right visualization doesn't just present facts. It makes your message stick long after the meeting ends. We also need to talk about the presenter as a storyteller, understanding that a brilliant data story can still fall flat if it isn't delivered well. That's why mastering the art of delivery is just as important as the content itself. As the presenter, you are the storyteller. Your job isn't just to share information, it's to guide your audience through a journey and make them care. Start with your vocal tone. Use variety, emphasize keywords, pause at critical moments, and avoid reading in a monotone. The way you say something can be just as powerful as what you say. A well-placed pause can give your audience time to absorb an insight before you move on. Body language also matters. Make eye contact. Even in virtual settings, look into the camera. Use hand gestures naturally to emphasize points, and stand or sit upright to project confidence. If you're passionate about the data and the story, let that passion show. People connect with authenticity. Remember, your audience isn't just listening, they're watching for cues. If you appear rushed, disengaged, or distracted, they will tune out. But if you deliver your message with clarity, energy, and genuine belief, they are far more likely to stay engaged and act on what you share. In short, be the storyteller. Don't just present slides, deliver an experience. Then, how can we overcome common pitfalls? Because even experienced presenters fall into traps that weaken their message. The most common? Jargon, data dumping, and overloading with detail. Healthcare is full of complex terms and acronyms, but remember, not everyone in your audience has the same technical background. Use plain language whenever possible and explain critical terms briefly so you bring everyone along with you. Then there's data dumping, showing every single chart or metric you have. Thinking more is better. It's not. Too much data dilutes your message. Choose the 3 to 5 most powerful data points that drive your narrative forward and put the rest in an appendix for reference. Another common pitfall is losing the thread of your story. When you switch from slide to slide without clear transitions, your audience can get lost. Always connect each insight back to your main point. Remind them why it matters and what it means. Finally, watch your pacing. If you go too fast, your audience won't absorb the key insights. If you go too slow, they may lose interest. Practice balancing energy with clarity so they stay with you from start to finish. Avoiding these pitfalls will make your data story sharper, clearer, and far more memorable. And we have to know and believe that practice makes perfect. Great data storytellers aren't born, they're made. And the secret is practice and feedback. Rehearse your presentation out loud, ideally in front of a trusted colleague or mentor. You'll quickly notice if sections are too long, too complicated, or not engaging enough. Pay attention to where you stumble or lose momentum. These are areas to refine. Use feedback to improve not just your slides, but your delivery. Were you clear? Did you speak too fast? Were the visuals easy to follow? Did the story inspire action? Don't be afraid to iterate. Every time you deliver a data story, you get an opportunity to make it better for the next time. Record yourself and review your body language and tone. You might discover small adjustments, like slowing down or emphasizing a key phrase, that dramatically improve impact. Practicing doesn't just polish your performance, it builds confidence. And confidence is contagious. When you are confident in your story, your audience feels it and trusts your message. So, make practice a habit. Treat every presentation as a skill-building exercise. Over time, you'll go from simply presenting data to delivering a story that motivates action and inspires change. Driving a data-driven culture is not easy because data storytelling shouldn't stop when your presentation ends. The real power comes when it becomes part of your organization's culture. A data-driven culture means that everyone, from analysts to executives, understands that data isn't just for reporting, it's for decision making. And storytelling is how we bridge that gap. Start by empowering your teams. Encourage analysts to go beyond just compiling numbers. Teach them to craft narratives that explain what the data means. Invite cross-functional teams to work together when building reports, so insights are not siloed but shared across departments. This cultural shift also means creating safe spaces to discuss data, even when it reveals uncomfortable truths. The goal isn't just to celebrate wins, but to learn from gaps and act quickly. Leaders play a huge role here. When leaders model data storytelling, asking for the so what, insisting on clarity, and acting on insights, they set the expectation that data isn't optional. It's part of how the organization learns, improves, and grows. Driving this kind of culture turns data storytelling from a one-time skill into a shared language across the organization. And that's where transformation truly begins. The leaders of tomorrow will be judged not just on their ability to manage teams or budgets, but on their ability to translate data into action. In a world flooded with information, the people who can extract meaning from data and communicate it clearly will shape the future of healthcare. Whether it's medical affairs professionals guiding evidence generation, clinicians improving care pathways, or executives setting strategic direction, storytelling will be the differentiator. This isn't just a nice to have skill, it's becoming non negotiable. Imagine trying to drive digital transformation, launch innovative therapies, or implement value based care models without the ability to explain the data behind your decisions. You'd struggle to get buy in from stakeholders, secure resources, or inspire change. Healthcare leadership in the coming decade will belong to those who can combine analytical rigor with emotional intelligence, who can use data not just to inform, but to inspire. When we master data storytelling, we make data human. And when data becomes human, it becomes powerful enough to change systems, influence policy, and transform patient outcomes. Here's where I leave you with a challenge. Don't let this be just another tutorial you watched. Take the next step. Look at the reports you create or consume every day. Ask yourself, Are these just numbers, or do they tell a story? Do they answer the so what? Do they inspire action? Start small. Take one upcoming presentation and transform it into a story. Identify the hook, simplify the data to highlight the key insight, and end with a clear recommendation. Pay attention to how your audience reacts. Then teach others. Share what you've learned with your team, with colleagues, with peers. The more people who learn to tell data stories, the more powerful your organization's decision-making becomes. Data storytelling is not just a communication skill, it's a leadership skill. And the sooner you embrace it, the sooner you'll start driving impact that goes beyond the boardroom and straight into the heart of healthcare delivery. So take action today. Your next story could be the one that saves time, saves resources, or even saves lives. Thank you, and see you next time.